Alright, good morning TI community from the UK and UK investigators. Right, I'm exposing Coventry City Council establishment for what it is. Coventry Police, Coventry Undercovers, the healthcare, social services, NHS, mental health network, the corrupted, abusing and authority ones that targeted me and my mother and destroyed my brother wherever he is. Whether they've killed him or they've hidden his identity and put him into institutions, that needs to be investigated. And that's why they can't swoop in on me or my mother. But they're still doing illegal surveillance monitoring, skullduggery, trying to reddit us, disable us, maim us, and got a network on us 24 hours a day. And they're using the local community and workplace mobbers to aid and abet them in fabricated, falsified, scripted, manipulated, paid for witness and statements, all linked to my old organisations, and they're surrounding us daily from all four sides, 360 degree, every 360 degree trigonometry angle you can think of, because the senior players in Coventry Police are corrupted, racketeering, abusing, the murderers, the lazy bums, and that many crimes happen in Coventry. There's been a few murders, once happened at the weekend in Stoke-on-Trent. These covert operators could have done something about it, and they could have listened in the area instead of wasting the resources, the manpower and the equipment and the finances that they're wasting from Coventry Police to Coventry Healthcare to Coventry NHS to the Swansea Centre Doctors Administrators, where I'll put links in yesterday where they get funding and get government grants for doing bogus, fraudulent, edited research, clinical close-up research, using other people's identities, other people's bodies, other people's activities, the other technologies they've got, and they get funded by it all. They get grants. That's linked to the mental health system and to the NHS illegal researchers, what I'm exposing. So on this morning on BBC One, Morning Live, we're talking about the social services system, healthcare and NHS, and virtually telling people hospitals are no good for people, nor mental health institutions, as TIs know. And that's why I'm exposing these lot on Coventry Council establishments. I want them all imprisoned. Every police officer, every healthcare, every social worker, every NHS, every mental health administrator, and every Swansea Centre doctor psychiatrist is participating with racketeering, abusing an authority, thieving, lazy bum police officers, disgusting, evil, grotesque police officers, or whoever the covert operators are, and they've mentioned all the local people's names, thinking that I'm going to talk about them. Yeah, like I said before, if these local people are involved, I'll apologise to them. But I want a major investigation into where my brother is. They made him disappear, and they've watched us for that very close. They know where he is, we know what's happened to him. And I want a major investigation into Coventry, West Midlands Police Force, the DCIs, the CID, and the uniformed police officers that kept turning up in my flat. Sergeant Horton, Sergeant Kirby, they said their names are. So we'll get to the bottom of it all. I want them all investigated. They're all thieving. They're doing cybercrime on my phone, on my internet. Yeah, watching me during the World Cup. I'm thinking they can steal my bets and then try and wind me up over it all, saying all the local people are winning and police officers are winning. So that needs to be investigated by Lloyd House HQ, West Midlands Police Force headquarters, where the police commissioners are and where they can get investigations started.
In half an hour, we kick off England and Wales's journey in the World Cup with former England international Dion Dublin, who's live from Qatar. He has ones to watch ahead of their first games today. But first, we're looking at the silent crisis that is gripping the NHS. Thousands of hospital beds are being filmed by patients who could be sent home, but there aren't enough carers to look after them. And what's going on with this?
So there's kind of perfect storm of problems. The reason there aren't enough carers is because of the cost of living crisis and inflation, meaning that there are other jobs that pay better. These are low-wage jobs, and so people have no choice but to leave them. So we've got a shortage of beds, we haven't got enough people, we haven't got enough money. So that means that there are a huge number of people occupying beds in hospitals. That means, first of all, that's not good for them, because being in hospital isn't great for you, but also it means that patients who do need acute care in hospitals can't get them. So we've already seen 2.2 million to people in the community this year as a result of missing care workers, and really huge amounts of missing people and resources, meaning that there is a long-term problem with getting people out of hospital and getting the care they need. 1.6 million over 65s in the UK not getting the care they needed in the community.
I think that 2.2 million was the first 3 months this year. What have the NHS said about this? What was their response?
So we did reach out to the government and ask for a comment, and they've said that 500 million will be given to the NHS, and they say that will speed up patient discharge, therefore freeing up hospital beds and reducing ambulance handover times, and some of that money will go towards improving the capacity of social care, but it is a big problem.
Yeah. Well, what about the patients who are ready to be discharged right now then?
So if you're stuck in hospitals, the idea of social care, which is a system that's 70 years old, it's a really, really essential part of care in this country, is that it supports you with activities of daily life, whether you have medical needs or social needs, whether you are elderly or ill, disabled in some way, or you have other ways of accessing things, that the care is intended to do that for you. So if you are stuck in hospital, you get a real deterioration of your health for several reasons. Hospitals are designed to treat illnesses. They're not designed to convalesce, and they're certainly not designed to stay in as accommodation over the long term. So you get muscle weakness, you can get bed sores, of course there are infections going around in hospital. As well as that, and this is maybe the largest problem, is you get institutionalized. It is very lonely and boring being...
So that's the same for the mental health system, mental health institutions. Yeah, they want to isolate targets into hospitals so they're way out of the community. That's the whole ideology of a targeting program. Yeah, disassociate the target away from family, friends and community members. So that's why I'm exposing the COVID team leader, and I want him imprisoned. Everyone's going to remember this in Coventry for the rest of their lives. Yeah, this COVID team have to be imprisoned for the good of humanity. And all the people who think they can keep a memory of me and my family in the Coventry community who've been paid, bribed, manipulated, brainwashed to participate as community and workplace mobbers, stalkers or covert operators or over operators, trying out different stage scenarios that includes all our workplaces. And there's a couple boys from Coventry who were just mentioned this morning, Paul Phillips, who went out with Mark Sexton. He's another lowlife who supports Aston Villa, and he needs to be interrogated along with everyone else about us gave illegal statements, falsified statements, witness reports about me working at the time at SCS. We're all in it together. But remember, don't want to pay compensation out, and I'm exposing them for a bunch of corrupted, racketeering, evil, bad-mouthed, bad-minded workers who aided and abetted the police force, aided and abetted mental health, healthcare, NHS people to do illegal research on TIs, aren't me, targeted individuals. And then they've abused my mother and done all kinds of neuroscience skullduggery on her, done all kinds of psychology via how TIs expose it all, voice to skull, Psyops, Alan Frey, auditory effect, surrounding targets 24 hours a day and playing psychology with them. And then try and disrupt the mind of that person they've got it in for by making out everyone's against them or everyone's ganging up on them and coming out with all kinds of rubbish, which I can decipher and do not believe it. But when it comes to people who don't know about the system, like my mother, yeah, they just twist their heads up. So that's why I want to see a leader, broken police officer, West Midlands Police Force, investigated by Lloyd House and imprison every Coventry police officer, every CID, DCI, to be juniors at Training Shady Police Training School and get to the bottom of it all. And that's why I'm investigating SCS, the company I worked for 13 years. And because I left there a long time ago, just like when you leave a company, they have to give you a reference. So what kinds, yeah? So how can they get witness reports, statement reports, and fabricate stories? How can they give that to NHS, mental health, and to illegal researchers who are criminal practicing and they've been found out? I've exposed them as criminal practicing. They're taking photographs, videos, and sound recording my family every day. So someone has to go to prison for it. That's the senior management in Coventry Police and the Coventry CID and whoever the NHS people are, healthcare people are, social services people are, and whoever the social centre doctor psychiatrists are who are participating in this illegal clinical close-up research, studies and clinical close-up trials in the works area and in the community. So I'm warning the senior covert leader, you can't hand nothing in. You go into prison for it. That's the memory of all Coventry people are going to have of you. You're disgusting, you're evil, you're broken down, you're humiliated, you're embarrassed, and you're disgraced to society. You won't even show your face to me because you think you can get a court order. So I'm letting the judge and jury know. I'm too confident for you, I'm too intelligent for you. I know how to hold a conversation. I know how to bring your team down, your Coventry police down, your Coventry council down, and all your sector abusers. Even your Zena. She's not going to get away with it. She's going to be ruined by the time I've finished with her. And no one in Coventry can stand up for her. She's practicing like the Germans. That includes anyone else who's in the association. And even if it's after Psyops on Zena, we'll get to the bottom of all who the boys and girls are who are stuck on Coventry, and whoever you're networking to, we will imprison them. They have to be imprisoned for the good of humanity, for the safety of national security in the UK, and for the safety of our community in Coventry.
Hospital, it's not an attractive or pleasant environment to be in, and the uncertainty is very unpleasant as well. So it is a very difficult situation to cope with.
So if you've got like a friend or a family member in hospital at the moment, and people are watching this right now, what advice would you give? How can they help that person in hospital?
So there are things you could do. I mean, it is worth saying the people who are most affected by this, that kind of 13,000, 14,000 people who are in those hospital beds, are people on low incomes, people who are already vulnerable, because if your family is wealthy enough, has enough time, has enough accommodation to get you out of hospital, they will have done it already. So these are a group of people who are really having a rough.
And that's why they're trying to disrupt my finances, trying to stop me from earning a wage, trying to keep us at the bottom of society. That's why they didn't progress me in the works areas. And that's why they've gone into works areas, manipulated, paid, bribed. That includes community members, the old association, grandfathers, grandmothers, older boys and girls than me, who've manipulated my works management and even used agencies to get me work where everything was already set up for me not to progress. And they used other people's in the works area to give them falsified statements, witness reports, and made phone calls to social services trying to say I'm incapable of working and doing my job at whatever I was put into. While all linked to cyber security, national security risks, these police officers are doing cybercrime and networking all my information from my football over 18 years. I know a lot of people who don't know about this targeting program won't believe it, or the community members will try and stand in me, saying, oh, I don't know what it's talking about, it's a bit deluded. Yeah, this is what racketeering corrupted police officers do, who are paid off or use police informers, paid off by community members who've got too much money, got too big for their boots, and they use police informers and local addicts to surround targets and to try and stitch people up in the community who they think they can get out of the way and disassociate from the community and try and cover it all up by trying to institutionalise their targets. That's what they do to TIs. Where they put them into prison, they can think they can get stitch and frame up with criminal investigations, racketeering undercover CID, or they can use their associates, their boyfriends and girlfriends who work in the healthcare system, try and detain the targets and try and put them to either care homes or mental health and try to register them into social services. So there's going to be a major investigation into Coventry Police. Whoever spent it all and whoever seen the Covert team leader is going to prison for a very long time.
Already, but it is possible to support people. When people are acutely ill, maybe there's less of a family or friend rush to go and visit them. Visiting people in hospital is really important. You don't have to be someone's best friend to draw up a rota or a schedule and say, look, we'll come and see, even if you can only go once every couple of weeks, get some other people involved, go and visit them, take them for a walk, mobilise them, make them feel like a normal human being, bring them food that isn't chocolates but is nourishing, healthy, nuts, fruit, vegetables, things like this.
Get them out of bed.
Get them out of bed. Even sitting in a chair is better for you than being in bed.
When they surround targets, like they've done to me and my family, they're trying to derange them, trying to break them down, trying to put them through a crisis, trying to disable them, trying to maim them, and then they make up loads of lies, slanderous claims, trying to say the target's degenerated, the target's vulnerable, the target's a loose cannon, the target has malfunction, can't look after himself or herself, and that the best thing for him is divine intervention, and try and get court orders and try and put the target into adult care homes or mental health and try and get them registered by the social services, healthcare, corrupted targeting system.
So anything you can do to sort of normalise life in hospital.
Of course, money comes into it again, doesn't it, when it's about care and when you leave hospital. What if you're struggling to afford care when you do leave hospital? What are the options?
Yes, so there is a system called NHS Continuing Care, which most people have not heard of. But if your primary need on leaving hospital is health as opposed to social care, then there is money available for all aspects of your care. So it is well worth talking to your healthcare providers about it. And there's an organisation called Beacon that gives free advice. And the numbers here, it is 0345 548 0300.
There's also been talk of virtual wards, is that right?
It's so interesting, this. So clearly there is a chronic long-term problem, but one of the ways of getting people home is to make sure, the essential thing is to make sure they're safe. And there is enough technology now and people are connected enough at home that sending them home with pulse oximeters, glucose monitors, blood pressure monitors, cardiac monitors, all of these things can be sent in a package, and then with visits from healthcare providers, nurses, doctors, other community support workers, then you can end up in a situation where someone can be safely at home, where they can recover or be looked after long term without taking a hospital bed.
There's loads of charities that help with this as well. So there is help out there. We've put a list of those charities on our website, so all the details of that are on the screen right now. Thanks, Sam. It's not just the NHS that's reviewing its budgets. With money tight, lots of us are looking at ways to scale back on spending. But imagine trading.
So that's that on the social service system in Coventry. And like I just said, this day and age, there's a financial crisis looming, coming on around the world. Prices of the cost of living's gone up, and these covert abusers have been watching me spending more money for 18 years, trying to do illegal research and thinking they can edit it all and hand it into healthcare, social services, NHS and mental health people to get a damning personal prosecution. Now, that's all illegal. It's all criminal practicing. The Coventry Police, West Midlands Police Force have trained their people on how to use all these technologies that I've exposed over the years. From thermology, infrasound, ultrasound, and then got NHS people involved, mental health people involved to use audiology, and then to study human behaviour, body language, and watching us 24 hours a day. Heads have to roll. People have to go to prison for it. And I've warned the Covert team a long time ago. Yeah, I'm too tough for you, too mentally strong for you, and I'm going to imprison everyone who's aided and abetted your healthcare, your NHS, your mental health, and the sons of our centre doctors to get illegal criminal practicing research on me, my mother, and my brother. And the Coventry Police are behind it all, and so Coventry Police have to be arrested and have to be in prison for it. And that has to be all over the UK national news, TV, newspapers, radio, and social media. That's what I've got in the senior covert team leader. Is a disgrace to intelligence teams all over the world. Is a disgrace to UK police officers. Is a disgrace to UK NHS England. Is a disgrace to psychiatry, psychology, sociology, and human behavioural science and neuroscience. That's the kind of research we've done on this. I want it all found by the UK intelligence teams. So TIs, digest it all, psychoanalyse it all. Coventry Police watching with interest, desperate interest, obsessed interest, and your healthcare, NHS, mental health, social services in Coventry. Listen to what I'm saying. Name the senior covert operators. I'll name them all, especially the senior leader. He's put a team together and imprison them for life. Everyone have a good day. Over and out.